Welcome back to our live show. We are on Facebook, Twitter, and Instagram, and you're watching us on samaditv.com. Feel free to send your questions if you have any related question to this, and we have access to many experts that we will try to get the best answer for you if I can't answer them myself. And to a lot of physicians and doctors out there, if you have interest to be on our show, we welcome that. You can also go on my website, samaditv.com, and send your information, and we'll have you as a guest on our show, and I think that's going to be very exciting. We talked about stress, we talked about sleep, which goes hand in hand, but you know, when you don't sleep enough and you're under tremendous amount of stress, guess what happens? The bedroom is not going to be happy and the sexual function is not going to be great. 30 million Americans, men out there, are suffering from sexual dysfunctions. And the way we're treating this, in many ways, it's really not great, because they come in, they get a prescription for Viagra, for Levitra, for Cialis, and then they go out. And that's really not the way to go. So let's distinguish between sexual dysfunction and actually lack of libido or male menopause. When we talk about male menopause, we're talking about your testosterone being low. And there is a true meaning of low testosterone, meaning that you check your testosterone always before 9 a.m. You never want to check your testosterone in the afternoon, because that number is going to be low. So remember, check your testosterone before 9 a.m. And if it's less than 300, then we have a problem when we have to talk about this. And there are a lot of health and healthy food that you can take. We talked about oyster, we talked about many things, even red meat that can help with your testosterone. But the biggest way to boost your testosterone is to lose weight. Now, weight and testosterone, what does one have anything to do with the other one? Well, guess what? In our belly fat, there are enzymes called aromatase. What they do is they take your testosterone, they convert them to estrogen, and as a result, you lose your libido. You get man boobs. You have no interest in having any kind of activity. That's all testosterone. Today, we're talking about sexual dysfunction. I see many young guys coming in, 25, 30-year-olds, saying, hey, doc, I can't have any sexual activity. I was fine 3 months ago. Now with a new girlfriend, I can't perform. What does it mean? A lot of this is psychological. And I think we need to make sure that that performance anxiety is out of the way. We need to make sure that we really help them to get through and boost their confidence, and not just give them a medication and get them out of our office. One of the things that comes up with young men, if truly there's a physiological problem, is to watch out. Because if you have a 30 or 40-year-old man that comes into the office and truly has erectile dysfunction, I would be concerned about a heart attack. The first sign of heart attack in young men is sexual dysfunction. Can you imagine? I repeat, the first sign of heart attack in young men is sexual dysfunction, because the arteries that are in the penile tissue are smaller than the arteries in the heart. So the same mechanism of high cholesterol plaque forming blockage of the arteries in the heart happens in the penile tissue, and they may have erectile dysfunction. Obviously, these are rare occasions. We see aging has a lot to do with sexual dysfunction as we get older. But I will tell you that 70 to 80% of the time, men that suffer from sexual dysfunction, they have some underlying problem, medical issues, high blood pressure, taking psychiatric medications, taking blood pressure medication, beta blockers, and also diabetes and many other things. So until we fix those, it would be very difficult to really boost their sexual function. Now, it is true that I think medications such as Viagra, Cialis, and Levitra really have revolutionized the way we practice medicine. These medications are what we call vasodilators. They open up the vessels in the penile tissue, and they're fairly safe. You always have to talk to your doctor and make sure that you're able to take it, so there's no conflict with the other medications. But we use millions and millions of prescriptions of these medications, and they work well. Cialis is obviously longer acting. It stays in your system for a longer time. We start with always Cialis 5 milligram. It's a safe medication. And if I need to, I can always add Viagra an hour before. Viagra only stays in your system for about 3 to 4 hours. You always take it empty stomach, because fatty food is going to absorb that, and it works well. Never take these two medications at the same time. Many times, if the oral medication doesn't work, we're going to go to many things such as suppository. You may have heard of Muse, which is a suppository in the urethra that we use. That works out really well. There are many easy and cheap ways to take care of this penile rehab, we call it, or bringing sexual function. Vacuum pump is something that is very available and it's easy without side effects. If all of these treatment options fail, then a more drastic one is something called penile injections, which is something that we offer here. And it works well by giving a tiny little needle and injections. Medications such as Edex or Trimix actually helps. And if all fails, then we can go to surgery, and there's a lot of surgeons out there that do a phenomenal job with penile prostheses, and we have people in our department and many urologists across the world. And these implants today work very well. They're very natural and easy to use, and I hope it helps you. So overall, I think it's a big part of your health. I think having a healthy sexual function boosts your immune system. It helps your cardiovascular. It actually is a great way to burn calories. It helps with your concentration, and overall is a great way to reduce your stress. Now you see how we bring the sex to stress, how we fix the sleep to help a better sex life, and it all comes together. We're going to take another 30-second break, and we'll come right back. Thank you.